Hello, friends. Welcome back to Wellness on Well Time. It's a wellness shift moment where we talk about the health tips that we need to be healthy and to stay well. And today, we want to talk about high blood pressure in young adults. Young adults are the people between the ages of 18 to 39 years old. What can cause a high blood pressure in a very young person at that age? There's so many of them, and one of them is lifestyle. What kind of lifestyle are you living? What are you doing about your life? How much are you contributing to, maintaining a good weight? Are you doing anything about your weight if you're overweight? What kind of food are you eating? How much salt do you take? How much canned foods are you taking as a young adult? Are you conscious of what you eat? Are you conscious of the kind of food you eat? Or do you just go about eating all the fast food in the street? You just eat anything you see. That is not good. And also, how much are you moving around? How much activities, do you take? How do you walk around? Or do you just sit down in one place? That is being inactive. That is sedentary lifestyle. And some people genuinely, they're just there because that is the kind of work they do. But you need to be conscious of it. There are some things you can do to be active, even if you have to sit for 12 hours or 8 hours a day. You still need to make out time, probably like 30 minutes at least 3 times every week to be active. This is an intentional things you do to be well, to make sure that, that you're not sick. It is not too much to ask of yourself. Walk around for 30 minutes. Cycle your bicycle for 30 minutes. And if you have a treadmill, depending on the type of work you do, you can use your treadmill at any time in the middle of the night, whenever you want it. It's just intentional actions that you need to take. And then, do you smoke? Do you smoke anything smokeable? That is not good for your health. Also, alcohol. How much alcohol do you take? If you ever have to take it, how much do you take? You see, a good life is a decision. Making that decision at a young age is the best. That's why you need to be conscious of what you can do to help yourself. And another aspect of this is, how did your parents transfer anything to you? What disease is your parents struggling with? What are they struggling with? Your mom, your dad? Have you ever asked them the medications they are taking, what are they for? You need to ask them, even if you are below 20. Because you're intentional about your health. So you need to know everything about you. Because parents transfer some genetic, things to their children, which is natural. It's none of your making. But you need to know whether your parents are struggling with this high blood pressure. And that makes you a risk factor for it. And you need to be conscious of it. And also you need to, know how much do you have any disease in your young age? Some young people, they have like kidney disease. They have what they call sleep apnea. When you sleep and you have to, stop breathing for some time, some seconds, and start again. All this contributes to it. How do you snore so loud? Do you snore at night? If you snore at night, you need to check out whether you have a sleep apnea. And also some are diabetic from childhood. If you're diabetic from childhood, yes, you might, you might have high blood pressure if that is not controlled. Then, what kind of medications do you take? Some young girls or some ladies would take birth control. What is the effect of the birth control you're taking? You need to know. And also, when you have minor pains, how much Tylenol or paracetamol do you take? Because taking them too much, it is not good. You need to help your kidney, you need to help your body, to work on them. And there's a limit. How much do I need to take in a day? You need to know. Also, some people, due to, some childhood issues, they're on steroids. Being on steroids, can make you have this if they're not controlled. Then we talk about the street drugs. So many people get into street drugs due to peer pressures. You need to watch it. It can never ever help you. You need to be conscious of what you put in your body. You can't contribute to being in hospital all the time. And so many young people are coming to hospital with heart failure in their 20s, in their 30s. It is really disheartening. And also, we're talking about stress. As a young person, everybody have a stress. But the issue is, how do I control my stress? Do you have any mechanism to control your stress? And sleep. How much sleep do you get? Do you get a quality sleep? And some young adults, they're just on their phone through the night. Chatting, pressing. Before you know it, it's morning. You have maybe like a 1 hour or 2 hours. You need to turn off your phone and get your good sleep. So, what can I do? First of all, you need to maintain a healthy weight. Work on it. Maintain a healthy weight. That will help you, to help you to prevent high blood pressure. Also, be active. If you happen to walk in a place where you sit for hours, find time to walk around. Find time to make sure that you are active. That will help your life. Also, the type of food you eat. How much salt do you take? You really need to cut on the salt content because the water follows the salt and it's not good for your body. Then we talk about smoking. Smoking has never helped anybody out of stress. Rather, it causes more stress, more damages to your body, to your arteries, to your vein. You need to quit smoking. And you need to limit the amount of alcohol you take. If you ever have to take any, limit the amount you take. Whatever is happening around you, your health should be your priority. What I'm putting in, is this going to contribute to my life or is this going to destroy my life? You need to be conscious of it. And the last one, but not the least, is to check your blood pressure all the time. Check it regularly from time to time. Just buy the small cuff. It's so easy to use. And I tell you, you wouldn't have any stress checking your blood pressure regularly. And also remember to follow us and to share this because someone beside you might need it. Your friend might need it. And remember to follow us on our Wellness Shift TV on YouTube. And also our Wellness to Wealth page on Facebook, where you see detailed, tips about your health that you need to follow. Thank you. I remain blessed. See you next time. Bye.